Good evening and good afternoon to you in the US, to everyone. Thank you for being here today. My name is Jelena Milic and I genuinely appreciate the opportunity to share with you my findings with such a distinguished audience. Your engagement means a lot, and I hope that the insights presented today can contribute to your understanding to the crucial intersection between neurology, mental health, and psychotherapy. On to the topic, the long-term psychotherapeutic follow-up on the patients with a neurology and brain disorder. We are going to focus on exploring the impact on the mental health and well-being by actually focusing on the long follow-up and the outcomes of the long follow-up on the psychotherapy. What I expect that the audience could possibly learn from this presentation today is the impact on the long-term psychotherapy, patient insights, success factors that I will define later, research significance, which I will elaborate, and challenges of the follow-up in the psychotherapeutical treatments, which I will specifically talk about. How the audience will use what they learn. I hope that the audience enhance clinical practices that they can apply. I hope to support clients better, that we can develop tailored interventions upon what we hear today, that we can advocate for the research more now that we would find out about the potentials of the follow-up research, and the most important, improve the patient care. I would like to tell you something about introduction to the convergence of the neurology, mental health, and psychotherapy. It is very important to explore these connections. Understanding these links is crucial. Impact on the patients has widespread effects because the neurological disorders, as you all know, affect millions globally and influence on psychological well-being. I don't want to go to details now for the public health experts and social media to focus on the ALIS, QALIS, and ALIS, the indicator variables that we actually follow by upon these issues, but I can tell you that this has a huge impact. The role of psychotherapy can be potentially solving. The significance of a long-term follow-up, however, is yet about to be established. We presume is essential, this is our hypothesis, and in fact, for improving patient outcomes and importance of integrated care approach. Our primary and secondary aims that we devolve into this research are primary, assess the impact, illuminate potential benefits, explore patient experience, and identify key factors, and the secondary, most of all, to mobilize the psychotherapies workforce for ongoing research. The rest you can see on screen. The challenge of neurological disorders is mostly what we see as a burden of brain disorders. Alzheimer's, Parkinson's, multiple sclerosis, and more, leading by all the types of dementia and Alzheimer's and the longevity era. As you know, all the life expectancy progresses and it's becoming longer. Therefore, the declining function of the cognitive potential of the female and male, female, by having them first as living longer, are in challenge. And then also patient coping mechanism, need for tailored interventions, and long-term effects on quality of life. Because this is actually what we want, right? In the 21st century, we do not want to speak anymore about health, but we want to speak about quality and dignity. So aging, not only healthy to the potentials that we can, but with dignity and with quality preserved to its best potential. Methodology that we use is a mixed method approach, explained in detail on a slide. The patient experience matters to us the most in this research, and this is the voices from the frontliners. They claim that the subjective experience reveals coping strategies, and this is what we hear from our patients on a psychotherapy. Throughout their studies, to our case reports, we identify the variety of coping strategies and then trying to identify the best ones and then to make them more generalizable and to give them back to the rest of the population that likes the coping. Perceived changes in mental health that we spot on from the interviews, that we can notify as the important and establish certain patterns. Role of therapy in daily life, is there a benefit or not? Importance of patient engagement, because it has to be interactive if you want psychotherapy to work. And the emotional well-being lead to therapeutic follow-up that we actually only aim to explore. So this is still in front all of us to find out about. The impact of mental health outcomes is therapy's transformative power. We do believe that improved psychological symptoms can actually be highly significant, that enhanced quality of life metrics can be shown to be also highly significant after the psychotherapeutic follow-up that is sufficiently long. We expect functional outcomes that are analyzed, evidence-based, and can be proved. Long-term benefit versus short-term fixes, we expect to prove that we would gain to the fact to prove that the long-term benefits are going to be actually possible to prove. And at the end, therapies as continuous support system, we hope to prove as a necessity, especially in the geriatric patient and more in the geriatric patient with the neuropsychiatrical, specifically neurological and with comorbid psychiatrical states. Key factors for the success of this drive on several positive outcomes. First of all, patient-therapist relationship quality, positive compliance. It has to be good, there has to be a good click to it, otherwise you all know it will not work. So we all need to try to establish a good human-to-human relation to our patients, and that is what we aim to do, and that is when we get the best results. The individualized treatment plans, this is what we all now hear more and more about, the tailored program, tailored treatment, tailored therapists. This is also very, very individualized. Consistency and continuity of care, which is necessary for any kind of follow-up, needless to say. Empowering patients through the education, something this is also a necessity because we need to learn them. I'm going to rephrase. We need to help them to help us. So we need to learn them how to help them to help us. So they need to help us so we can help them. It goes both ways. We need to help them to help us, and we need them to help us to help them. Support system derives from this and goes beyond therapy session. There is always a reflection time between two therapy sessions in which my patients personally for more than 10 years now are telling me, but Dr. Jelena, actually I've been thinking and I've been gaining from what we discussed when I was sitting home and having time with my children, grandparents, pets, when I was watching my show, when I was doing some recipe or preparing my food, or was working on my Pilates or whatever. So they reflect, they rethink, they summarize, they introspect. They then actually take our dialogue, interiorize it, and introspect it as an inner monologue. And this inner monologue makes the genuine change and then return to me on the next session as again a dialogue between two of us brings the incorporated change. So that's why I say that the change actually happens throughout the time between therapists. What are our most important research implications? They're advocating for ongoing inquiry. First of all, I would emphasize the importance of continued research in this area. We need to go on. we do not have sufficient study. Lack of the study is evident, and therefore this proposal to begin with. We need to mobilize psychotherapists for data collection. Psychotherapists are a bit of a lazy subpopulation of a healthcare professional. In what way? I do not want to sound defensive. I'm just realistic, including me. It took me 8 years to do my doctoral thesis because I was focused on my clients parallel to my research, and I could never made a very clear, let's say, line to draw between what is my exclusive research time, paper writing time, publishing time, book writing, monography writing time, and my patient's time, because I was always there for my patients. Sometimes I think that the clinicians from the other branches, because I'm a medical doctor, so I speak like a medical doctor now, not as only a psychotherapist and a doctor of science of neuropsychiatry. I tend not to have clear limits. We need to set the clear limits and be more effective in order to set sufficient time for research versus sufficient time for the practice. And I think I'll make a point here, point to remember, and maybe we can later on discuss, that in the field of psychotherapy and mental health, we are not clear with the boundaries as yet in this regard. Then bridging gaps between neurology and psychotherapy, I think, will become much more easy, and enhancing the treatment efficacy through this evidence then evidently and surely become more easily processed. Challenges in follow-up will be navigated through therapeutical roadblocks. Here I define you some. You can take this as a note to take home and maybe reflect on what you would add personally. Implication for the clinical practice, for me, based on transforming treatment protocols, are as follows. The integrating long-term therapy into care plans needs to be more elaborative, and definitely educating healthcare professionals in the area of specific family, and if you allow me, family supportive psychotherapy amongst everything nowadays in the 21st century, when the nuclear family almost does not exist due to the IT, to the globalism, to viral life, to all of us having virtual part of support network, social network, eco-social sending, and everything diminishes the value of the nuclear family and our loved ones that sit in the next room. I have a patient who have an all-day conversation with mothers and fathers in the same house, sometime in the unit of the apartment, via Viber or WhatsApp chat. Think about this. I'm not going to comment. I'm not the one to be judging or to be putting flags, but it is something to think about. Is this wise? Is this socially positive for the cognitive and social intelligence of the growing person, especially teenager or adolescent, and even for our aging dear ones, for our older people, for elderly? Is it good to be isolated and communicate with dear ones via Viber or WhatsApp? Let's think about it for a moment. I would also like to advocate for mental health resources. We need them more. We need more budgeting. We need more voluntary specializations in education, both for caregivers and the mental health professionals, and we need more training, and we need more places where this can be given. Emphasizing continuity of care needs to be more present. There is a stigma, there is a taboo on psychotherapy still. We here today, all united, need to break it or raise awareness. There is no shame in taking therapy. It's as preventive as taking a dental check. If you do that, why do you not go and check how do you feel emotionally? It's a highly stressful world we are living. It might make you more burdened and damaged than a caries or some kind of other tooth problem. For that, you will go to dentist to check. For the other, you will not. It's also time to reflect upon that. Then, what we mentioned, the tailored intervention. Based on the findings that I mentioned, the policy development needs to be proceedings of our just mentioned topics. The informing healthcare policies need to be based on implications on findings for policymakers, enhancing mental health support systems, advocating for funding and resources as we lack them significantly, developing integrated care models, and ensuring accessibility for all therapists. Educational application are necessary. We have insufficient number of mental health professionals in all categories: primary, secondary, tertiary healthcare, psychotherapists, coaches, consultants, even the caregivers who need to also be very strong in mental health aspects. We do not have sufficiently trained or educated professionals. Fostering academic growth can help. How? We need to be incorporating research into curricula. Without the research, we will not gain the evidence-based finding that will then make the trajectory good to what we need to address. Engaging students in the related fields is necessary from the first point of coming in the higher educational institution related to the healthcare. Promoting interdisciplinary studies. Interdisciplinary studies are necessary. In the 21st century, one cannot know IT, one cannot know graphic design, one cannot know to, as you see, make effective PowerPoint or speak a good language to be heard by many, or have a good presenting skill and not be timid. We need to work on ourselves on multiple aspects to empower ourselves as a health professional, to be empowered by many skills to be able to perform holistically. We also need to encourage innovation in therapeutical practices, and this innovation will be led, or they will have a driving force by the things that will derive from the research and from evidence-based knowledge. We need to prepare future professionals for challenges. The world is changing as we speak. You know, all of you know what is going to be like in the next year with everything going on in the world. And I think the majority of us working in this sector expects uprise in the mental health and as well and is neurological fields problem, an increase in morbidities and also sadly in mortalities. So empowering healthcare practitioners is necessary. Tools are listed here for you to have a quick overview. Benefits of long-term follow-up matters because it will enhance patient engagement and satisfaction and better treatment, along with improved mental health, greater resilience in patients, and empowering patients in care. Building collaborative networks to power of collaboration is of high importance. I hope that this is why all we gather today. Fostering partnerships, sharing knowledge, creating research-focused networks, which I hope that will be the consequence of the meeting today. Importance of interdisciplinary approaches and building a supportive community for patients is for me the most important thing. The future directions for research were mentioned. but this is just the bullet pointed thoughts for you to take home and to reflect upon. In the conclusion, I would like to summarize the key insights, the importance of the long-term psychotherapy when we take into account the people with the neurological diseases and comorbid psychiatric some, understanding patient perspectives as the most important thing, advocacy for continued research as a necessity for us to move forward and to help geriatric subpopulation that is increasing hyperbolically, I dare to say, enhancing clinical practice for better outcomes and collaborating for a holistic approach to care. Call to action. Join the movement. Now, don't wait. Contact each other. Contact me. You see my contacts below. Take a screenshot. Take a photo. Take a moment. Advocate for mental health integration. Participate in the research initiative. Share insights with the colleagues. Don't be timid. Don't be shy. Foster discussion on the best practice. Support your patients on their journey. Call them. Ask them. Demand, ask, seek their feedback. Motivate them to think, to reflect, and to write, and to give you feedback. And that is what I wanted to emphasize. I would like to take the moment to thank my all dear colleagues from the Institute of Public Health of Serbia. We celebrate our 100-year anniversary, and our slogan is 100 years for health. This is the part of our actions. We are now rebuilding and rethinking how to move forward in the further actions of the preventive medicine. And you can see my contacts below for the follow-up. If time permits, the floor is now open for your questions. Thank you kindly.